Care for coffee, sir? Kind of.
I have some.
All right. And just want a little warm-up, huh? Is that regular?
Well, my first connection with the Cancer Center happened in the year 2000 when a loved one was diagnosed with stage 4 cancer. My husband did pass away in November, but I always remember the kindness. And it was several years before I really could come back and say, I got to get back to that place. So we started coming and serving cookies and coffee and a smile, so to speak. And so, everyone loves those three things, and especially if they have a loved one who's going through treatment. And it's so nice when you're at Mayo Clinic to say, here, you can stay in Sioux City. They have a great cancer center.
June Nylen was a nurse who developed a malignancy. She was a fighter. She never complained. She was a person that really was a modern-day hero. And this is a unique situation where we have all these people, all these needs being met for the cancer patient.
No.
Okay, and you haven't been on any steroids?
No.
So it's not just run in, get treated, and leave. The big change has been that now we consider most cancers to be a chronic disease, something that patients can live with a good quality of life.
Well, about November of 2007, I was diagnosed and given from 2 to 6 months without treatment. And I was introduced to Dr. Winder and his associates here at the June Nylen Cancer Center. And I'm almost 14 months into it, and I'm doing good. I have several friends that ask me, why don't I go to Mayo? Why don't I go to Chicago? Why don't I go to Houston? I figure we've got the best here, and I'm not making any changes. Everybody is so wonderful. All the nurses and techs, everybody, chemo room, everybody's just so attentive. And you get lots of hugs when you're here, too.
The two hospitals, we work together, and to be able to see a need in Siouxland, to have our radiation oncology and our medical oncology in one location has been wonderful for the community.
I'm a 7-year survivor, and Ron is a...
let's see, 6 years.
6-year survivor.
6 years been coming here.
Mine, I can understand breaking the camera.
Well, I organize the support groups for our patients and facilitate the breast cancer support group and the general cancer support group. And then I also organize the resource room, which has educational materials for patients, and our wigs and turbans that are available to our patients at no charge. It is a very, very important role, I think, that we all play. Our patient navigator, our chaplain, our dietitian, the nurses. It's very holistic.
Every day is different. I do a lot of different things with the chemotherapy and radiation patients, mostly different side effects. I may give you helpful hints how to prevent nausea, what to eat, what not to eat. If you have taste changes, I may give you helpful hints on foods that may be tastier, how to make your food taste differently. I mean, it's frustrating for people that can't eat, who have no appetite. We're all bugging them to eat. So just little helpful hints to help them get along and just to see their smiles.
Being that it is a community-based center, I think most people are sensitive to the fact that they may be treating their neighbors or their friends, that even from the minute they walk in the door, I think that they're met by very helpful, supportive staff who know them by their first name or get to know them. And that's where I get my satisfaction out of the field, is when I know that this treatment has been tailored to this individual in such a way that it provides the most benefit as well as the least amount of side effects. And we try to also stay on the cutting edge. For this purpose, I use the trilogies that we have here at the center. It's very satisfying to know that patients had the maximum possible response and possibly a cure.
real scared, considering they told her that they didn't know how long she would be alive. So we were pretty much not expecting that. The talks with Sister and a couple of the other ladies that work here, they made it very understanding for us to, deal with everything.
And as I remember the many faces that have, come to the Cancer Center, I'm just remembering with gratitude the patients and their caregivers, their loved ones, are such an inspiration to me. An inspiration in the sense of reminding us of being grateful for so many blessings that sometimes we take for granted.
It was breast cancer. I think I was 31, but my daughter told me I was 34 when I was diagnosed the first time. So that's been 22 years ago, and now this is my second time around. My granddaughter told me she wanted to get her hair cut, and I said, why? And she said that, well, you're going to lose yours, Grandma. I want to donate it to Lacks of Love. But you can wear it. We'll put it in as a wig, and you can have it. I lived through this, and it makes me feel better and hope. These people do a lot. They give you the willpower. If you're down depressed, they can bring you right back up. Or try. I'll just be glad when I don't have it no more.
The thing that gives me the greatest pleasure is being out and about, meeting all the patients and their families. It is such a privilege to serve in this way. I've met some awesome individuals. They're filled with grace and courage and full of hope as they face what could be considered by most of us a very devastating diagnosis.
We walk the journey, with our patients, and always with hope. And I think that's a message that is very clear at the Cancer Center.
You don't have to have cancer to be here, but it's a good place to be when you do.
Spectacular. Nylen is the greatest place that I could imagine my mom going for her care for cancer.